Hello, my name is Amy Rojas, and my presentation is about breast cancer. There are many types of cancer, and this one targets majority of women in their breast. So there's a couple risk factors that you could have. You could get the chance of getting breast cancer. One is if you're over 50, you have increases of chances of getting breast cancer. Genetic mutation, such as you were born with it in your genes. Another one is having dense breasts, so your breasts feel more dense than it normally should be. Personal history of breast cancer is that, well, you or your family member has had breast cancer, so you're in a high risk of getting it also. Previous treatment using radiation therapy. So let's say if you've had another health problem and you've had radiation therapy, you have a chance of getting breast cancer because the radiation. And women who took the drug diethylstilbestrol, I believe it's pronounced. It's a medication that it was given when people were pregnant in the 70s, I believe. And this medication gives you breast cancer as well. So decreasing risks of breast cancer, well, there's not 100% way you could avoid it, but there are some things that you could do to make yourself less of a chance of having breast cancer. So one is not to be overweight or obese, so try to be more active and be healthy and eat a healthier lifestyle. Menopause, well, we can't really control that because we all hit the menopause, but we definitely could be aware and be more precautious about it. For those who have taken hormones, that definitely helps you decrease it. Reproductive history. So let's say if you gave birth during after your 30s, and you didn't give them breast milk, so you have a chance to get breast cancer. So you should give them breast milk, especially if you had your kid over 30 years old. And drinking alcohol. So I would consider to not drink alcohol so you can have a less chance of getting breast cancer. So those are the things that you could do to decrease your chances of becoming a breast cancer person. So the pathologies is that you could see right here, you have a normal breast tissue, how it should be. But those who do have the breast cancer, you can see the black spot is a cancer stem cells, and you can see how the tumor is being created with those cells. And you could see how you could see the lumps outside with the little wiggly stripes are at, and that's, you can see how those are creating lumps, and it's because of the inside where the cancer is at. Compared to the normal one, everything is functioning normal. So here's a video of the stages of breast cancer that we see in a person. We have 4 to 5 stages of breast cancer, and you can see that's a normal one, stage 1. Stage 1, you're starting to get that little bit of a tumor there. Stage 2, it's starting to cross and affect your lymph nodes. And stage 3, it's starting to spread more. So I believe you would be most of like lumps and stuff. It would spread to the skin tissue and to your collarbone as well. In stage 5, it would be that it went all over your body, like your organs, your lungs, your heart, your stomach, your liver, and your bones. Okay. So on symptoms and physical exam, so before we could detect breast cancer in women, is that you could do yourself a self-examining yourself. Sometimes it may be uncomfortable, but it's always good to check yourself. You might see lumps if you have breast cancer. You might see the pulled in the nipple, a dimple, a dripping nipple, a reddish rash, and a skin change. So if you do see any of these symptoms, it would be good to go get a self-examination with a doctor. If you do find any of these things that may be concerning. And during that, the doctor might have you give a physical exam with a mammogram to double check that if those symptoms that we see could be breast cancer, especially if we have someone in a family history of breast cancer. I believe once you hit 25, a girl should start be getting mammograms every year, especially if you have a family history of breast cancer. So there's no cure for breast cancer, but there's things to calm it down and be removed. But it doesn't mean you're cured and it's totally, like a cold. So ways to get it, removed is surgery. So they'll be cutting that part where the cancer is at. There's also chemotherapy where you would get IV bags and stop the spread. And there's radiation as well, where you'll be getting radiation on that part of the body, but they would also be killing your good cells and the bad cells of cancer. There's also antibiotics medication to put a wall between the cancer and the good cells so the cancer cannot keep spreading into other places. And there's hormonal therapy as well. A fun fact, I actually know because my family does have breast cancer, is that if you have your baby teeth and your mother or yourself have them collectively and you get to a point where you get cancer in your life, especially breast cancer, those baby tooth can actually be used, and they will use those baby tooth cells and put them back inside of you. So when you're doing, your chemo, your radiation, and they're killing those good cells, you could actually get your good cells back with those baby teeth. So that's something to be, restoring back. And I definitely do have mine because my family is a high risk of breast cancer. So the progress is that the average of 5-year survival rate for women with a non-metastasized invasion breast cancer is 90%, and the 10-year survival rate for women is non-metallic invested breast cancer 84. The invasive breast cancer is located only in the breast. Of a 5-year survival rate for women with this disease is at 99%. The prevalence is that in 2021, an estimate of 200,081,550 new cases has invasive breast cancer are expected to be diagnosed in women in the U.S., along with 49,290 new cases of a non-invasion breast cancer. So some complications that you could come across with this breast cancer is that you will have scars after surgery removal. You might have hair loss. You might lose your confidence. I am sorry, I misspelled that. I just noticed. And not having breasts anymore. So you'll have a flat chest. You'll have swelling, and you'll have pain in your arm if you got the surgery. All of these things, some of them my family has come across too. This is why I know so much about this. And the painful arm definitely does stay with you for a while, not even after surgery you had and you are already okay. You'll still have the pain of moving your arm flexibility to back to normal. And confidence is something really impacted in women because you really want to feel that you have your vision, your image, just as anybody else. You don't want to feel less because you're of this sickness. And it's something really hard mentally for those that do have breast cancer. So the prevalence disease types in the US, including difference between men and women, is about 1% of breast cancer diagnoses in the United States are men. In 2019, about 700 men are projected to develop breast cancer, according to the American Cancer Society, compared to 200,000 women, meaning that it's more rare that men develop breast cancer, but it is still possible. And there are other types of other types of cancer that men get that women do not get as much. As compared to women, we see a lot of these cases more and more than men. So a brief description about the current research about this disease is that there is a medication called the scatutumupa. I'm sorry I mispronounced that, this drug, but it was granted accelerated by the FDA approval on April 22, 2020. And it was the first antibody drug to conjunct approval with the treatment of a metastatic triple negative breast cancer. So that was very wordy. So what it is, it's an antibody connected to the chemotherapy where it helps reduce and stop the spread of breast cancer in parts of the body, like compared to stage 5, where we saw that the other parts of the body started getting cancer. So this will help it stop going to that stage. And this medication is for patients who have had like 2 therapies prior to help prevent it. So that's where I come from, saying that, before getting the stage 5, we would use this medication on those people. And here's a list of my resources, and that would be all. Thank you so much, and I appreciate your time.